Good evening and welcome to Afrik Express. And this particular show will be talking about children, brain tumor, and cancer. And today we are right here in Brockton, and also we'll be talking to some medical practitioners from Dana-Farber in Boston. Today as my guest, I have with me here in the studio Dr. Susan Chi, who is a pediatric oncologist at the Dana-Farber Institute. Welcome to the show, Dr. Chi.
Thank you very much for having me.
Also, we have Christine Chauders, who is also a nurse practitioner at the Dana-Farber Institute. Welcome to the show.
Thank you.
You guys work with very peculiar group of people, which are children. How does it feel to be working with kids, especially in medical field? Christine.
I feel very lucky to get to work with the kids every day. Kids are amazing, and even those that are sick that we see are very amazing, even when they're feeling their worst. So it's really a joy to be able to work with them. Some days are difficult, but for the most part, it's a pleasure to work with them, and particularly their families as well.
Dr. Chi, brain tumor and cancer is something, for me, when I think of it, I'm thinking of adults. But the reality is there are children that do suffer from these. What causes this and why?
So, as you mentioned, most cancers occur in adults, but actually there are many children who also develop cancer. In terms of brain tumors, there are about 2,000 children in the United States who are diagnosed with a brain tumor. And here in Boston, we see about 130 children each year who are diagnosed with a brain tumor.
130?
Mm-hmm.
That is a large number.
It is. Although compared to adults, it's very small, it's still a large number of children who are affected with the brain tumors.
And there is a particular program which you guys work with, which is the brain tumor program.
That's right.
Does that concentrate only on tumor or cancer? Because correct me, because tumor and cancer, are they the same thing, if I may ask?
That's a great question, and we are asked that many, many times. We are oncologists, and there is a medical definition of cancer, but cancer is loaded with such emotion and baggage in some ways from other people, and sometimes a sort of stigma attached to it. And for us, we treat brain tumors. There's an entire range. There are tumors that are very low grade, and some people might say benign tumors, and it ranges to a very, very aggressive, malignant, and what is very cancerous, the type of tumor that may spread. And so it is a whole entire spectrum when we talk to families about what is a brain tumor, what is brain cancer, what is cancer.
So you used two words. You said benign and malignant. When you say benign, what does that mean?
Well, again, I think this is just language that we've come to be very familiar with. But what I may describe as benign is very different than what a family member hears as what is benign. And so we actually try not to use that as often, only because a low grade, a very slow growing tumor in a certain location may be very benign, where a surgeon may take it all out and that is the end of their treatment.
Right.
But that same very tumor in a different location can be very, very serious for a child, and may have devastating effects for them. And so that's why it's very difficult for us to use these words, because a benign tumor in a bad location can act very malignantly.
Christine, in your work, you deal a lot with the children one-on-one. Mm-hmm. So are you. But you also deal with the parents. You spend a lot of time with them. Mm-hmm. In this kind of situation, how do you break this type of news to a parent?
Mm-hmm. It's always very difficult to give parents and kids this news of cancer and a brain tumor. And I think we do it at Dana-Farber as a team, often going together. And we have a larger team back at the hospital as well, and talk with the families one-on-one and give them information. And we meet with them quite frequently in the very beginning to help them with the diagnosis. And we also use and rely on psychologists and social workers a lot to help us work and talk with parents and help parents be able to talk with their children, not only the child who has the cancer or brain tumor, but also the siblings, because it's a very scary time for everybody.
Right. Yeah, to break that type of, as a medical professional, break that type of news to a parent, then to break it to a child, assuming that the child is of age to hear what is going on. Mm-hmm. You know, it must be like you say, a difficult time for everybody involved, but it is something that has to be done. We have a Brockton resident who comes to your clinic, who you're taking care of, Ralph Edward. He's had, I believe that since he was a child, he was first diagnosed of brain tumor. Mm-hmm. He is on his fourth regrowth. How do you use the word?
We use the word recurrence.
Recurrence, mm-hmm, okay.
Mm-hmm. He was diagnosed actually when he was very young, and he's had multiple surgeries. And at this time, he's, as you mentioned, the tumor has come back a couple times, such that we have recommended further treatment, and that treatment has been chemotherapy. His last chemotherapy was a couple years ago, but even after treatment is completed, we continue to get the MRI scans, and most recently it had shown that it had grown from where it was, and so we had recommended retreating Raphael.
So, Christine, once the treatment is done, mm-hmm, the family still continues to come back for MRI.
Correct.
And yes, that's how you detect that. How often are these MRIs?
Well, they do vary, but first, when the child is off treatment, we typically follow them every 3 months in our clinic. And they come to us for an MRI, as well as meeting with us and having an exam and talk about school, how their learning is going, how their social life is going, how they're doing physically, mentally. We try to cover everything in that visit every 3 months. And then as they get further away from their treatment, we space out that perhaps to every 6 months.
Okay. We will take a break and we'll come back and continue this discussion.